Honestly, nobody really talks about this. Dental students are quick to put their clinic face on and just seem like they've been doing this work for a very long time, even before having lifted a handpiece towards a real-life patient. Transitioning from the sim clinic to the main patient clinic can be pretty overwhelming, to say the least. In this video, I'll be going over what every dental student should know before transitioning from working on plastic to real-life patients. Stay tuned. Hello friends, and welcome back to another video. My name is Teham Saud and I am a third-year dental student at ASDO, aiming to help aspiring dental students and together learn about all things dentistry. I'm just 3 to 4 months away from my 1-year mark with working with patients, and boy, the few months that passed flew by like nothing. Transitioning from the sim clinic to the main patient clinic for myself was really exciting, but very nerve-wracking too. I soon learned that it wasn't just up to me to be comfortable with doing my job, but I had to make my patient comfortable and they had to trust me with everything that I was gonna do for them. Like I said, everyone's approach to their transition in clinic is unique, but if someone tells you that they aren't even the slightest bit nervous regarding transitioning to clinic, I promise you they're lying to themselves and to you, straight up. So being in sim clinic, you go in every day, you pull out the mannequin, you get your typodont ready, and you start drilling away. However, in clinic, your care for the patient starts before they even sit in the dental chair. During your last appointment, your patient may have shared with you that they're scared of going to the dentist and they're deathly scared of needles. That's why they've been putting off going to the dentist, and they decided to actually come in because they've been having some excruciating pain that they just couldn't put off any longer. It's my job and your job to comfort these patients and to commend their bravery for confronting their fear so they can take care of what needs to be taken care of. You're gonna explain before you get started that you're gonna be poking a needle into them. You're not gonna use those words though. You're gonna make sure that the patient's comfortable, and you're gonna explain to them that this is just gonna help them get through the procedure so that we can take care of whatever needs to be addressed. In sim clinic, you're easily able to move your mannequin right to left if you can't access a tooth or see something. It's easy to move it. In the main clinic, you're not gonna be able to have that luxury, and you're gonna have to ask your patient to move to the right, to move to the left, to tuck their chin down so you can see the mandibular teeth properly. All of these things are gonna be learning experiences for you, and I'm still trying to learn them myself. Your patients may be scared, your patients may be anxious, your patients may have a lot of questions. So what are we gonna do to take care of them and make them feel comfortable? This is just one example of how sim clinic can't absolutely prepare you for everything that you're going to be thrown into the main patient clinic. The thing we just have to remember at the end of the day is that we've learned these procedures and we've performed them so many times, and we just have to replicate them again. At the end of the day, we are treating the oral cavity, but there's a person behind it, and they have a life and they have a family and they have a community. So we have to do our best that we're not only performing the procedures, but we're making the patients comfortable and they're educated with whatever we're doing and why we're doing it. For myself, it wasn't only comforting that I knew that I'd have my procedures evaluated at the end, but that I'd be progressively getting checked along the way throughout the entire process. But through my experience, I learned that decay and all of that is pretty unpredictable. You're going to be presented with many situations where decay presents much deeper than you anticipated, and you're going to have to figure out things and do things differently than what you may have learned in sim. And this is where the expertise from the clinical directors at your school comes in clutch, because they know exactly what to do in every situation because they have years and years of experience. Having clinic directors watch you and guide you through the process allows for new techniques and just new ways of approaching things click way faster, and you'll remember them every single time something like it presents itself in the future. My first restorative experience was something that I'll never forget. Patient came in, we had to do a filling on number 13. It was gonna be a buccal class 5. We've done so many buccal class 5s in sim clinic, and I thought it was gonna be pretty straightforward. So when I took a look at the tooth clinically and everything around it, I saw that there was no number 14. So I thought it was going to be even simpler and I wouldn't have to worry about adjacent teeth. But after taking a closer look, I realized that the decay wasn't on the buccal aspect. It was on the distal aspect of the tooth. I put 2 and 2 together and noticed that the tooth itself was rotated 45 degrees. So the buccal aspect of the tooth was now distal, and the distal aspect of the tooth was now lingual. So I was told to do a buccal class 5 on a number 13 that was rotated. So I had to do that class 5 preparation with indirect vision for the first time. We learn how to use indirect vision mostly for class 2s and class 3s and class 4s, but we're never taught how to do class 5s with indirect vision, because usually it's always in your direct line of sight. Like I said, in sim clinic, the class 5s that we've pretty much worked with were that you'd have a facial class 5, there would be no decay, and there's no rotation of the tooth. So these were the few factors that presented themselves when I was told that I have to work with this patient. I don't know how, but I got it done with the help of my classmate. She was assisting me, and with my clinic director checking along the way and telling me to approach things differently, take out extra flash, make sure my prep was clean, all that stuff. And I knew that I couldn't have done it if I didn't have the help around me, especially because it was my first time. This is exactly what the real life experiences in clinic will present, and you have to be ready for them. There's nothing you can assume from your past experience that can help you with tomorrow's patient. Every patient's unique. They're gonna bring different things to the table that you may not have heard of, may not have worked with, but it's your job to learn them as best as you can so that you can be better prepared for tomorrow. Something that I noticed from working with patients was that I noticed a very stark difference manipulating composite on plastic simulation teeth versus real natural teeth. It would always take me a lot longer to take off excess composite and just manipulate the composite before curing it on plastic than it does for me on patients on their real teeth. I don't know what it is, but just the instruments feel like they really glide on the teeth better and just immediately take off the excess composite. Whereas on plastic teeth, I feel like I have to go over the cable surface margin of all of my preps like 10 times more to make sure there's not even a speck of composite on it. But I don't know, the natural tooth structure just glides off so much easier, and all of the burnishing tools really just adapt into the anatomy a lot better. I just feel like I can manipulate the composite a lot easier for some reason. I don't know why. That's just how it's been for me, at least. Know that you definitely learned a lot to get up to this point, and you should be excited. But there should also be a fair amount of just uncertainty, because you know you haven't seen every potential scenario that you may be presented with in real life. It's going to be super fast paced, and it's going to be up to you to learn as much as you can. The repetition and the amount of times you keep seeing patients and doing procedures is going to continuously improve your proficiency, efficiency, and knowledge of what you're doing. The biggest advice I can give to anyone that's about to start clinic is just be ready and eager to learn. Be receptive to criticism, learn how to care for your patients, learn from your patients, take notes, ask questions, and always be ready to learn something today so it can help you tomorrow. Hope this video was helpful. I'll catch you guys in the next one. Peace.